The number of new coronavirus cases is on the rise in many states, including one of the country's original epicenters, New York. At least 29 states have seen an increase in the average amount of new cases per day. Over the weekend, Montana, Wyoming, South Dakota, Minnesota, Wisconsin, and New York set one-day records. The Empire State reported more than 1,000 new cases in a day for the first time since June. In Brooklyn, the health department is monitoring a growing number of COVID-19 cases, putting school principals at odds with Mayor Bill de Blasio. Principals want state officials to take control of schools there. The union representing school principals voted unanimously to approve a motion of no confidence in Mayor Bill de Blasio's plan to reopen schools. In-person classes for K through 12 students are scheduled to begin this week. There are over 7 million COVID-19 infections in the U.S. More than 200,000 Americans have lost their lives due to complications linked to the virus. Joining us now from Staten Island, New York, is Dr. Cioe-Peña. He is the Director of Global Health at Northwell Health. Dr. Cioe-Peña, thank you so much for joining us. You know, just days after we reached the 200,000 coronavirus deaths in this country, we hit a new number, 7 million cases nationwide. So do you see this as a pivotal point for stopping the spread of the virus in terms of next steps?
Certainly, we're heading into a new phase, and I think that we really need to start thinking about coronavirus as being a local issue, local problem with local responses. Absolutely. I think we're going to start seeing, not this large wave in New York City that we saw in March and April, but smaller contained epidemics like this, that if we allow to continue, can become a citywide epidemic again. So we do need to continue the vigilance. We need to keep up the pressure on this virus, and it will be more difficult as we move into the winter.
And so now, how are you treating COVID-19 patients differently now, for instance, than in the spring? Have there been any lessons learned leading to more effective treatments?
Certainly in the most severely sick, we've had advances. We know what we're doing. We know drugs that don't work, most importantly, and we know some of the drugs that have shown some efficacy. We are able to detect COVID much faster in patients. So our turnaround times for our lab tests are much improved from March and April. And our knowledge of how the disease is transmitted, how patients can go home safely and prevent their family members from getting infected. These are all things. The biggest difference is the amount of knowledge we have about this virus going into the fall.
There is also some reporting that a lot of these cases that are now the currently positive are not so severe, not as bad as they were in the spring or the summer. Is that accurate, or is that just a reflection of better treatments?
It might be a reflection actually of just better, more widespread testing, that we're detecting less symptomatic cases. Certainly, it has skewed to a younger population, which experiences less complications, but we're not out of the woods yet. Our older population isn't less susceptible to it than it was in March and April. And so as people start to intermingle and the older populations get affected again, we're going to see much more complications.
And then with flu season approaching, doctor, and these cases that we're seeing in 29 states spiking, how concerned are you about burnout among your colleagues, not just here in New York, but also for health professionals across the country?
Yeah, I mean, it's a real concern. I mean, our medical kind of forces, if you will, don't have lots of reinforcements, right? So the front line is going to stay on the front line until this is over. We try to give our colleagues a break, everybody taking their fair share, but that's not only going to do so much. The biggest impact you could have on healthcare workers right now is going out, getting your flu shot, wearing a mask, washing your hands. Reducing those flu numbers as well as the COVID numbers are going to make a tremendous difference in the lives of first responders and frontline health workers.
It's a very good way of putting it. When you wear a mask and when you get your flu shot, you're helping them. If you need an excuse to do it, think about the first responders. So in his testimony to Congress, CDC Director Robert Redfield said that he suspects that wearing a face mask, a face covering, could protect him from COVID-19 better than any future vaccine. And it got us thinking, how long do you think people will be wearing masks even after a vaccine is approved and most Americans have been vaccinated?
Well, I think that, whether the use will be as widespread in kind of schools and other, educational environments or sport events is questionable. But I do think that even once we have a vaccine, kind of this idea of if you're feeling ill, put on a mask, you'll reduce the transmission of whatever infection you have to other people as a common courtesy may stick around, and it's certainly good public health.
As perhaps the death of the handshake, do you see that as good public health?
Yeah, no comment there. I hope that some things can come back to normal, but definitely it's questionable.
For now, that one is definitely put to bed. All right, so Dr. Eric Cioe-Peña, thank you so much for joining us.
Thanks for having me.